So I told my mother I'd be filming this, so just say "Hey Fran" to the, just yell Fran. Hey Fran.
Hey Fran.
All right. So my presentation is titled "Que Ordinario: The Health Disparities of Sex Workers in Valparaiso, Chile." And I did this while I was on an SIT. I did it as an independent research project with SIT Chile, public health, traditional medicine, and community empowerment. So I just kind of want to give an introduction to Chile. Right now, Chile is kind of considered a moderately developed country ever since, and it has been increasing ever since the fall of the dictator Augusto Pinochet in 1990. He kind of put himself to the test and said, you know, I really think people like a dictator in 1988. So he said, you know, I'm going to let people vote to see if they want me in for another 10 years. And they didn't want that, so he left 18 months later. And ever since then, but he did, while he was dictator, open up to a free market system. And so it's kind of helped booster Chile into as an upper middle income country right now, as according to the World Bank. And right now, Chile has two public health systems, one that are private and public. In 2000, the Chilean government said, well, we understand that we really have to increase development within the country, and we also have to recognize that people need to see themselves as, they need to have an incentive to increase awareness of public health. So they need to see that their own health benefits the public's health. And so they kind of did a healthcare reform that was a lot better than the one the United States handled. But I want to kind of give you a health status of Chile as it is currently and presently. And as you can see right now, the birth rate is kind of just a little bit higher than the United States. The life expectancy is a little bit lower than the United States. And the infant mortality rate is only slightly lower than the United States. And it compares better. It's better than most Latin American countries. And it is because they have this really great investment into their public health system. And they also kind of have this model that other Latin American countries kind of envy. But I want to kind of talk about the system before, and then I will get into the meat, the juice, the sex workers of this presentation. And so their first public healthcare system was called FNASA. And what that does is it's divided in kind of what they call 4 sections, tramos, which are based on income. And so depending on what your income is, that's how many services you're provided. So if you have an higher income, you're more likely to get the medical services, the dental services, and the mental health services. If you're at a lower income, you're definitely going to get the medical services, dental services. You only get kind of a partial amount of those. But it also kind of determines within the traumas how much you contribute to the national healthcare system. So if you're kind of in the lower trauma, chances are you won't be paying at all into the system because the government recognizes that you need to improve your health before you can work or do anything else. And then there's something called AHE, which is a list of diseases or conditions that FONASA, which is the public healthcare system, guarantees that they will treat. So it's a list of 59 conditions, and STIs and HIV are under that list. And so they will say, not only will we take care of treating it, but we'll also take care of the costs of preventing it and also educating you about it. So that's a pretty great system. And then there's ISAPRE, which is only about 14% of the country only uses the system. But if people say, you know, I want a little bit more bang on my buck, or I might have a disease that's not covered under this list, then they can sign up for this private health care program and go with these private health cooperatives. So right now, prostitution in Chile is legal. However, it's kind of in between the lines because a lot of people don't understand what legal is, because what is illegal is pimping or using bordellos. And I actually went into kind of some of these bordellos or brothels, and the way that they get around that law is they kind of turn it into a bar in a hotel and say, no, we're just kind of entertaining guests and not doing anything else. But the bigger issue, according to a lot of reports that I read, kind of locally done by the universities, is that many of these sex workers feel like there's a social exclusion of them from society because they live in certain neighborhoods in which they can't get access to care, or because many of them recognize that they're sex workers and kind of are, you know, spew hated things to them. And many people also, to justify their discrimination, kind of use racist terms. So what was very common in my experience is that if someone kind of saw a sex worker on the street, they'd say, oh, she's Peruvian, or she's Mapuche, which is an indigenous group. And they did that so that they could feel as if the way that they were excluding these people was justified. And then also many believe because they work in these bars and hotels that substance abuse is very common and that they're all drunks and drug addicts, which kind of was not the case during my research. And so it raises a lot of questions. And I should have explained this kind of as a public health person. A health disparity is when is kind of a difference in health as between kind of a certain population and a vulnerable population. And that disparity exists because of some kind of discrimination or some kind of racism, sexism, anything like that exists within a health system. And so, because of this disparity, I wanted to ask, do sex workers have a poor health status in general than other Chilean women? And does the public health care system understand kind of the needs of sex workers? Do they understand there's a different education level, that they can only come to clinics at certain times, and that they need different prevention strategies in order to take care of their workers? And so the HIV status and the STI status in Chile is a little bit similar to those in Latin America. For example, Chile has a prevalence rate of HIV of 0.4%. So that means that 0.4% of the population has HIV. And while Peru has a similar rate and Brazil has 0.5%, the United States has 0.6%. So you kind of can see the comparison there. But many of these people kind of get similar infection rates up. So men and women have equal infection rates, but these affect women a lot more because some of these are very asymptomatic for men. Meanwhile, this can cause problems such as infertility for women, and also kind of a lot of stigma if you're a sex worker. And the most common STIs in Chile are genital warts, syphilis, and gonorrhea. And HPV is kind of also becoming an STI that is being talked about in the community, but it's not covered under AHE, which is those list of conditions or diseases, so no one pays for the treatment or cost of it. So that's why there's kind of becoming this new concern in the community. And sex work in Valparaiso is kind of unique than to other areas, because many of these women not only have 2 or more children, but they also might have spouses or potential partners, and their partners either do or don't know that their partners are engaged in sex work. And the bigger issue is that there are a lot of clinics kind of in Santiago, which is the capital of Chile, that provide kind of STI services, but there's only one in Valparaiso that provides kind of sexual health attention, and they're the only ones that really recognize sex workers as kind of a special needs or a vulnerable population. The bigger issue is that they can't really take their own lives into their hands sometimes in terms of what kind of health choices they're making, because there's this machismo culture that exists in many parts of Latin America, but also exists kind of in the United States, where most of the decisions lay in the hands of the clients and not the sex workers. And so what I did is, kind of before I preface this, it was very hard for me to initially find sex workers. I had to be very creative, and I had to kind of figure out that this is where kind of the clinic, the STI clinic, is in this part of town. And so I interviewed 7 workers there, and then I kind of had to ask, where can I get into, what kind of brothels? Because a lot of brothels actually in Chile do not allow like foreign service members or people from other countries to come in. You have to present a Chilean national ID to get into them. And so I had to figure out which ones I was able. I only asked female sex workers to kind of participate in this study because I kind of wanted to see if there was discrimination or a health disparity occurring because of their profession or because of their gender in a machismo culture. And so what I had them do is I kind of sat them down and I had them complete a survey that kind of talked about their work environment, so kind of where they worked, kind of if there was substances involved in their work, the quality of their healthcare. So could you tell me how great your healthcare is, and also do you think there's discrimination from you, or do you think that people treat you badly in this setting, and also your behavioral risk factors. So how often you use a condom, how often you use birth control. Then after that, I kind of followed up and said, well, can you maybe comment on these type of things? So if they said, yes, I kind of experienced discrimination, I asked them, discuss it.